Hello everybody and welcome to the Tuesday edition of Video Clips, and I want to just take a couple of minutes, as I always do, for announcements. The first thing is we posted the summer semester schedule on the Wellness Form Institute's website, and a couple of things I'll just point out to you. We're offering the Diet and Lifestyle Intervention course with the celebrity instructors. That's Dr. Esselstyn, Dr. Stanger, Dr. Weller, Dr. Goldhammer, Dr. Barnard, Dr. Moss. I mean, a lot of people you want to learn from, and these people only teach this course one time a year in the summer. So we offer it other times, but only with the celebrity lineup in the summertime. So if you're interested in that, this is the time to take a look at it. We have some supplemental packages that go with it too. And then we're teaching statistics, actually starting in early May and running through August. And so people hear about taking statistics and they roll their eyes and they remember how miserable it was when they tried to learn statistics in college or something. But I got to tell you something, we have the best instructor here. His name is Dr. Ron Lewis. He's the favorite instructor in the school. People like him more than they like me, and I know that you probably find that so hard to believe, but really truly they do like him more than me, and everybody says the same thing about 6 weeks into statistics. I love this. I can't believe how much fun it is. It's fabulous. I'm so glad I'm taking this class. So if you really want to understand and be able to interpret and report the medical literature, you should take this course. And then I'm going to teach nutrition and cancer and treatment and how treatment and diet work together and all these kinds of things. It's a 10-week course, also starts in June, so you can check that out. For those of you in driving distance of Columbus, Eileen Kopsaftis, our physical therapy guru and business partner, will be here for a few days to work in one of our employer accounts, and she's doing a workshop here in our office on Thursday, the 16th, I believe it is, of March, and this woman, we call it got pain. If you've got pain or you don't want to have pain, she's the woman you want to see, and I think you'll be amazed at how quickly she can help you resolve aches, pains, back pains, sciatica, I mean all the stuff that makes all of us uncomfortable. And then last but not least, I want to talk about extensively about this project that we're doing with Dr. Peter Breggin. He's also a business partner. The two of us together have developed this course called Why and How to Withdraw from Psychiatric Drugs. The course will be offered through the Institute, but it involves the videotaping of several different lectures that Dr. Breggin is going to do and will be part of the program. And we're filming them here, and we're going to allow 25 very lucky people to spend 4 days with Dr. Peter Breggin, the psychiatrist who has literally been the most outspoken person against drugging people who have psychological illnesses. And so anyway, you'll get to, it starts on Thursday, March 30th, it runs through Sunday, April 2nd. It includes a private dinner with Dr. Breggin on Friday night. And you will learn about things like depression and despair and bipolar and anxiety, OCD, panic disorder, ADHD and behavioral disorders in children, psychosis, autism spectrum disorders, schizophrenia, the drugs that are used, the right way to withdraw from the drugs. So it'll be a tremendous opportunity, 18 hours of formal instruction, dinner with Dr. Breggin on Friday night, but also, as you guys know who've attended conferences before, you've got time in between sessions when people are just up and talking to each other. You're going to meet some fascinating people here, but you'll also have an opportunity to be informally engaging with Dr. Breggin too. So I hope you will consider coming. I mean, I'm looking forward to this, even though mental health counseling is not my practice specialty. I just can't get enough information from this guy. I think he's one of the most fascinating people I've ever met. He's a psychiatrist who's practiced for over 50 years and never drugged anybody and never committed anybody to a hospital or institution. I think that speaks volumes for his therapeutic skill and his integrity both. So anyway, that's what's going on around here. A lot of things happening, and we have every week when I make these announcements, I just want you to know, tiny little fraction of what goes on around here. We have so many programs for consumers, for healthcare professionals, career opportunities. I mean, there's a lot. So if you don't even know where to begin with us, send me an email, let's chat. We've got a lot of things here that are great for people. Well, what I want to talk about today is to piggyback on a video clip I did a week or two ago where I was talking about the American College of Physicians basically advising against images, drugs, surgeries, and in most cases even going to the doctor for a visit when you have low back pain or even chronic low back pain. Instead, patients are advised to, first of all, continue their regular activities. I mean, one of the big problems with back pain, or pain in general, is that some doctors tell patients, don't move, you'll aggravate it, that's a bad idea. And then patients become really fearful that if they engage in exercise or bend over and pick something up off the floor, that they're going to exacerbate the injury and make things worse. So anyway, what the ACP is saying, continue with regular activities, and the therapeutic modalities you should use are yoga, massage, and acupuncture for treatment. And research shows that the group is right. Not only are images useless for determining the source of the problem, most of what is traditionally done to help people in pain doesn't work, but the options like yoga are actually quite effective. So I thought, in view of that, I would try to see how many studies I could find and maybe report on that talk about yoga as a way to resolve or make better lower back pain, chronic pain too. And so the first thing is that the number of studies that have been published that show this are so many that we couldn't do just one video clip. I mean, I need to do a full-fledged, maybe 90-minute slide set on all the ways in which yoga, if it's done properly, can relieve pain. But I picked out a few that I can share with you, and I'll just start with the one that was the most impressive to me. Many of you have heard me talk about Cochrane Collaboration, the most independent medical research organization on the planet. And Cochrane, by the way, the co-founder of Cochrane, Peter Gurczky, will be a speaker at our fall conference here in Columbus, Ohio this November. So if you want to hear probably the grandfather of informed decision-making in terms of medical treatment is Peter Gurczky. Anyway, Cochrane actually did a review of 12 studies that included over 1,000 participants with lower back pain, and it showed that yoga was effective for both relieving pain and improving physical function, back function. And then there were all kinds of other studies that, in addition to this, and I'll just give you a sampling here. One randomized controlled trial involves subjects with chronic low pain who were randomized to take yoga classes or to participate in just an educational program about pain for 16 weeks. The participants had had pain for a long time. It's one of the reasons I selected this particular study, about 11.2 years. Almost half of them were taking medication. The subjects who were taking the yoga classes experienced a 64% reduction in pain intensity, 77% reduction in functional disability, and 88% reduction in the use of pain medications. And the researchers concluded that the majority of people with mild chronic low back pain would benefit from taking yoga classes. I thought that was amazing. Another study involved randomizing patients with chronic low back pain to either yoga or standard medical treatment. Patients assigned to yoga attended biweekly classes for 24 weeks, and then both groups were evaluated at 12, 24, and 48 weeks, long after the yoga classes and the intervention had stopped. The subjects taking the yoga classes improved significantly more in all areas as opposed to those assigned to standard medical care, including functional disability, pain intensity, medication usage, and, interestingly enough, even depression. Yoga students even fare better when the comparison group is engaged in other forms of exercise. So a one-week residential intervention program randomized 80 patients with chronic low back pain to take yoga classes and then to also attend regular sessions where they learned more about the philosophy of yoga. And the other group, the other folks were randomized to attend exercise classes which are done under the direction of a trained person. At the end of 1 week, the yoga group was better off in many areas, including pain, flexibility, and pain-related disability. Now, there are all kinds of mechanisms of action, and so I started looking for, has anybody investigated this? And they have. And the mechanisms of action that seem to have the most credibility, most evidence to support them were, first of all, self-efficacy. In other words, the person's belief in his ability to succeed. Again, as I mentioned at the beginning of this, one of the problems with people who have back pain or joint pain is that they tend to withdraw, be still, don't move, and to be very fearful that they're not going to be able to move again. So increased self-efficacy, increased awareness, and reduced fear. Reducing fear is important if you're going to recover from back pain, since fear often prevents people from engaging not only in exercise, but even regular activities. You guys heard me talk about John Sarno, the physician in New York who started doing knowledge therapy. he would tell people, go home and live your life and do normal things. That's the best thing you can do to recover. So anything that reduces that fear is a good thing. Another study showed that yoga practice increases something called brain-derived neurotrophic factor, BDNF, a protein that helps to maintain healthy neurons and stimulate the development of new ones. And this is at least partially responsible for the reduction in pain that happens when you take yoga classes. So the bottom line is, I think this is important stuff. First of all, because chronic low back pain is the most common cause of limited activity. It's one of the most common reasons for doctor's visits and one of the most common reasons for surgery and hospitalization. As I mentioned earlier, the traditional approaches don't do very well. My own mother was the victim of failed back surgeries, which was just one of the many terrible things that happened to her when she was in the medical mill. Well, on the other, and all that stuff is expensive, by the way. It's not only ineffective, it's ridiculously expensive. Yoga's inexpensive. It's available almost everywhere. I mean, it's astounding how many yoga classes take place in a given, even little towns around America on a regular basis. So and it's much more effective. So I think doctors should actually write on the prescription pad yoga classes for people who are experiencing back pain, joint pain, sciatica, that sort of thing. It's a low-tech, no-risk, terrific way to overcome pain and suffering, all right? So anyway, just full disclosure, Wellness Forum Health has a yoga studio across the hallway from this office, and I love having that studio here. I love taking yoga. It was part of my own recovery plan when I was severely injured in a car accident many, many years ago. And yoga, working out at the gym, those are the things that are the reason that I can run and do everything that I want to do, and I don't have any pain at all today. So from personal experience, I can even recommend yoga to you. All right, well, that's all for today. As usual, pass this on to anybody who you think might enjoy watching it, and I'll be back to you on Thursday with more news.